Hi, my name is Tran, and I'm a student pharmacist. It looks like you're picking up a new medication today. Can I verify your name and date of birth?
My name is John Clark, and my date of birth is 4/17/53.
Thank you. Do you have a moment to go over your medication?
I do.
So the purpose is to inform you about the safety and purpose of the medication.
Okay.
Just to get some background info, what did your doctor tell you about this?
So my doctor mentioned that I'm going to be taking this medication for my heart, but I don't really remember everything that she said.
That's correct. So it is. The doctor is using it for your heart. The medication is Coumadin. The generic is Warfarin, and this is a 5 milligram tablet. You're gonna use this as it's used as a blood thinner, and to prevent stroke and heart attack. You're gonna take 1 tablet by mouth daily for irregular heartbeat as directed. There are 30 tablets with 3 refills. If you happen to miss a dose, don't double up on medication. Call your doctor and let them know. If they're unavailable, go ahead and skip the dose and start it at your normal time the next day. So notify all your physician and other healthcare providers that you're on warfarin. Never take any medication, including over-the-counter products and vitamins, without informing your doctor. You will have a regular lab done. You will have regular lab done when you're on this medication. Your next appointment will be in 3 days. Your doctor will check your PT and INR levels to see if the dose that was prescribed is appropriate. You can take this with or without food, morning or night. However, it's important that you keep it consistent. So if you take it with food in the morning, you should do that daily.
Okay.
So food that are high in vitamin K can decrease the effectiveness of this medication. However, that doesn't mean you can't eat it. You can't eat food that are high in vitamin K. Just you would have to keep it consistent. So some examples of this would be your green leafy vegetables, spinach, broccoli, kale, and then also beef liver also has a high content of vitamin K. So you can eat these food, however, you should keep it consistent. So you should eat around the same amount each week. Some common medication that you should avoid when you're taking this medication is aspirin and aspirin-containing products, any vitamin K supplements, mineral oil, or X-Lax if you need to take a laxative, Maalox or Mylanta. Instead, you can take low-dose aspirin for pain, milk magnesia, or Colace. So I do notice that you are on ibuprofen. I recommend discontinuing because it does increase the risk of bleeding. So Tylenol would be a better option for pain if you need to take that as needed. However, it's important to keep that under 2 grams per day. So with all medication, you want to watch out. With all medication, there's a chance of allergic reaction. So if you experience any difficulty breathing, tightness of the chest, swelling of the throat, or tongue, go ahead and get medical attention right away and let them know that you're on warfarin. You will not feel the effects of this medication, but the medication's full effectiveness will be in 5 to 7 days. You want to monitor for bleeding, which is the most common side effect of this. So you want to monitor for any red, dark or cloudy urine, any bloody stool or dark tarry stool, bleeding of your gum while you're brushing your teeth, or any nosebleeds, minor cuts that bleed excessively and does not clot in 10 to 15 minutes, and if you're coughing up any blood. Just to verify that you got the important aspects of this, can you repeat some of that?
So I'm taking Warfarin 5 milligram tablets 1 time a day consistently, with or without food. If I were to start anything or discontinue any kind of medication, I need to make sure I let my provider know. I need to watch out for excessive bleeding, so if I don't stop bleeding when I cut myself, maybe like 10 to 15 minutes, then I need to contact the doctor, as well as if there's any blood in my urine or stools, or if I cough it up or anything just kind of irregular, to make sure I mention it to the doctor.
That's correct. Do you have any other questions?
I don't.
Well, thank you for your time. If you have future questions, give me a call.
Okay, thank you.
Thank you.